Hi, wonderful viewers. My name is Paul Abdurrahman Isadowona, Parrot for short. And today we have a topic that affects everybody. It's pain and pain management. You've had some form of pain before. I've had some form of pain before. When you had your pain, did you go to the pharmacy? Was the drug given necessarily helpful? If it was, anytime you have pain, do you still take that drug? Is that the right thing to do? What questions were you asked before you were given that medicine? Are painkillers for all forms of pains? There are a lot of questions that are under this topic, which we intend to break down with my guest pharmacist and my lay celebrity guest. Catch me after this short break. Thank you again, viewers, for staying tuned. I think this is a topic that if you are standing, you should sit, because if you stand through, by the time we are done with the program, you will experience what we are trying to solve. And it is pain. We've all felt pain at one point or another in our lives. But the question is, when you go to the pharmacy and complain of pain, what are you to expect? What kind of drug treatment is supposed to be given to you? What is the effect of not being treated properly when you come and complain of pain in the pharmacy? Is it okay for you to say that the pain I'm suffering is so much that I'll take more than the dose that has been given to me?
You can't watch
or on my own accord, I will change the drug and take what is termed as a higher drug, because what the doctor prescribed or what the pharmacist prescribed is not bringing down the pain. I know when you have pain, what you are looking for is quick relief. But is the quick relief usually the surest way and the safest way to go? By the end of this episode, we would answer all these questions. And as usual, I have my regular pharmacist, Farm Adams Akram.
Thank you.
Farm, nice to have you. What have you been up to?
Nothing much. I've been here and there.
Okay.
Keeping life together.
Anything interesting our viewers should know of?
Oh, nothing interesting. It's just the usual stuff.
You're just selling drugs to people.
I try to.
We're happy to have you.
Thank you for having me.
We're happy to have you. And once again, on today's episode, we are fortunate. He's taking time off his busy schedule of being a pastor, a man of God for that matter. And by the time we are done, he will tell us what God is saying about pain, since he hears God. And also an actor and a family man. Ken Fiati,
yeah.
We're happy to have you again.
I'm excited to be here.
The last time you were here was very exciting, and hopefully, I'm sure today will also be no different.
We'll see, since it's about pain.
Yeah.
We pray that we'll not be in pain.
By the time we are done.
By the time we are done.
Hopefully not, hopefully not. So viewers, we and as you already know why Ken is here. Ken is here to just make sure that the program sticks to its true nature, devoid of jargons, devoid of too much pharmaceutical terms. All we want is for you at home to understand the topic we are treating, so that next time you step into a pharmacy, you are well informed, better informed, and well equipped to ask your pharmacist the relevant questions that will help you to get the kind of treatment you are looking for. So Ken is here to make sure that the lay person also understands what is going on. Ken, I'll start with you once again. Now, I want us to take it from different angles, but we can tackle pain in a lot of ways. Maybe this episode will not be enough to finish everything, but let's even pick headache, which is a form of pain. When you go into when you have headache, what do you usually take? What does your pharmacist give you? What do the people behind the counter give you when you have headache? And does it work? And let me know.
The way Farm is looking at me, I don't know whether to say,
yes or
to
no.
say the truth.
Don't be threatened.
Or do otherwise.
But
you know, growing up, traditionally we were told that Gary is good for pain.
Oh, really? I never heard that.
Yeah. So,
Gary?
Yeah.
Okay.
Dry, crispy Gary.
You chew it?
So you put
Who
it
told
in
you
your
that?
mouth. I come from that line, you know, where traditional medicine is seen as the it.
Yeah.
And it's worked for me a few occasions.
Wow.
So I have known
So
pain.
you don't soak this, Gary? You just chew it?
No. I know you are thinking about adding milk, but that's not what I'm talking about.
If it's going to cure that, let's enjoy it. Right?
Yes. Well,
Okay.
I'm told that paracetamol has some cassava. I don't know whether it's true.
To some extent, because in making not that active drug, but when you put it all together, there's some starch, there's a few things. So,
so what they told me is you put some dry, crispy gari in your mouth, chew, don't swallow, but swallow the liquid that comes. Yeah. I still do it as a first aid measure. So I put it in my mouth before I go to the pharmacy, hoping that when I get there, I'll get the best of reliefs. Yeah. I don't go expecting that I'll come out with the pain totally gone. But I go hoping that whatever I'll be given gives me some hope that very soon that discomfort would have been taken care of. So I don't have a specific drug that I look at, because I have grown to understand that many things can cause that headache. So it's not just about paracetamol. And so I go expecting that I'll have the best of attention and be given the best of medication. But truth be told, when I am given a dosage and I'm supposed to take like 1-3 times, for the starters I do 2, thinking that it will help alleviate the pain faster. The rest I know it is very wrong, and we have to tell the truth at all times.
Just on that one, why is that wrong? If you go and then they say take it 1-3 times a day, and you decide that, look, my pain is too much, I'll take 2-3 times a day. Why is that wrong?
So it's wrong in the sense that an assessment has been made and a dose has been proffered for you to take, which should be okay. However, for example, his example of paracetamol, and the kind of dosages we have in our market, for him, 1 tablet may do the trick, but if you take 2, it would not pose any adverse effect to him. It may be he will be okay with it. Just that that is paracetamol. You may take something else, and if you attempt that, will be dangerous.
Just so our viewers are clear, I know you said to him, so I'm sure that in your mind you've made certain calculations based upon which you are saying to him, if he takes 2, it's okay. What if it is a 16-year-old, 15? What is that?
Obviously, that, So I'm looking at.
Being careful. He can feel the pain.
He can feel the pain.
Looking at my muscles.
I'm looking at the adult dose, and I think with the regular doses we have in market, I mean that should suffice. That shouldn't pose any risk to him. However, for a younger adult, I mean, once you do that, that becomes a challenge. But for me, I think pain is working in the community setting. Pain is you could say 70 to 80%. A lot of people walk in and it's pain. It's pain. It's pain. And because of that, we've had to look at pain in 2 ways. Is it acute or is it chronic? Acute pain would sort of last hours to maybe a few weeks. And usually the causes for acute pain are identifiable. Somebody has had a surgery, has had a cut, has sprained a certain part of their body. And so typically you want to treat that with your analgesics, your everyday non-opioid analgesic. By non-opioid, so you're just using basic drugs like paracetamol and very basic pain medicines to handle. The chronic pain is a bit longer. Some can last for months to years in certain people. And the prognosis is difficult because the causes are not easily identifiable. It's linked to a lot of things. So healthcare professionals will tend to want to manage it, to try to identify what the root causes. So they may initially start off with very common drugs or doses. If it's not working, they may combine. So in those instances, you find out that they're combining both opioid and non-opioid, just trying to have a certain mix of drugs to manage the pain, and they're a bit more tough to manage. It is okay if you walk into the pharmacy once in a while. You've done hard work. I experience headache after a stressful day. Sometimes just a pill of paracetamol or Panadol may work. Sometimes just take a glass of water and you rest it out and you are fine in a few hours. But there are other kinds of pain that continues to linger on. So you may take something, it goes off and it comes back again. And for me, that is the key area, because the drugs for managing it, while they may manage it, may have other side effects that we do not want to have in the long term. And I think that is where the focus should be for most people out there who go to pharmacy.
So Fam, as if even though you've broken down pain into acute and chronic, pain can also come in varied forms, right? So it could be stomach pain, it could be joint pains, it could be muscle pains, it could be a nerve thing.
It could be broken heart.
It could be broken heart. It could be broken heart. And Ken, who has broken your heart?
That's why I'm here.
If your heart were not broken,
for the masses.
They say if your heart is not broken, the broken heart syndrome will reach everybody. So
it will reach everybody.
Broken, just wait your turn.
So I should get ready to say, no,
come.
It won't reach me. It is not reaching me. But I want us to, and maybe we might not be able to do this in one episode, and the producers will advise on whether we can extend. But I particularly want us to look at headache, which is a form of pain. Then we'll look at joint pains. Then we'll look at stomach pain. Because I've had instances where people have come when I am in the pharmacy and said, maybe I want brufen. Okay, what's wrong with you? Pain. What's pain? Stomach pain. So he wants a painkiller for stomach pain. Is a painkiller what we use for stomach pain? Although that is also pain. Those are topics, questions I would like us to, I don't know whether we'll do today. But now I want us to focus on, let's say, headache, and to set a tempo and a background base upon which I would like you to build this discussion on. That when we take headache, and people come to the pharmacy with headache a lot, there are types of headache. It could be sinusitis. It could be a tension headache. It could be a migraine headache, right? It could be, as you said, one from just stress, which is usually what causes tension headache. If Ken came into the pharmacy with headache, what is the pharmacist or the person behind the counter supposed to do? Is it enough for Ken to just say, I have headache? Or Ken must explain the type of headache? Does that one inform the kind of drug you give at the pharmacy?
Yeah, that's a good question, because you get a lot of situations like that. But I would say that for me, at the level of care at the pharmacy, even though you have training around what a cluster headache would be, what a tension headache is, someone may present certain symptoms. Immediately, you may have an inkling that it may be this kind of headache. But for me, I don't think it's enough for a pharmacist at that point to then say, oh, it's a migraine, and so I'll give you something that fits a migraine, or it's another form of headache, and so I'll give you that. And which is why the community pharmacy is important. So if he walks into a pharmacy today for the first time, he has a headache, and I am there, regardless of the form of headache that I believe it is, even if I think I'm convinced it's a migraine, obviously I'll ask a few questions. What do you do? What is your daily routine like? What have you just done? Did you go through stress? Have you eaten? Stuff like that, just to elicit some information from him. But I'll be minded, and I think healthcare people should be minded, especially at that level of care. Let me start off with the bare minimum. As a new client who's walked to me, and I'm trying to assess, let me understand, let me give him what the bare minimum is to start off with, and then ask for feedback in a few days or a day later to understand if that is managing his care. Alternatively, I might also want to understand from him, how long have you been experiencing? Is this something you've been experiencing? If so, what have you been taking for it? What other drugs have you been taking? So that also gives me an idea as to wherever he's been to, how has he been managed? So that if I see that there has been a trajectory, a build-up of certain medications, then I can convince myself that, oh, then there's no point studying at this level. This guy has taken this, has taken that. He's at this level. And so I think that we necessarily have to, either you go there and then, and the thing with pain is, for most of the medications, there's room for you to navigate. So understanding what dose the person has been taking, and then seeing if there's room for you to tweak a bit. Do you up the dose a bit just to see what results you get before you do a step change? But at least engaging the patient, understanding where they're coming from, then gives you the next step. But in the absence of any relevant historical knowledge of what he has taken, he has not taken it, he just comes with a headache. The key advice should be, any healthcare person should start off the basic. Let the person try it. He may not actually need it, but start with the basic, which is very manageable. If it works, fine. If it doesn't work, then you proceed. Which is why it is also important that at that level, feedback is important. You have to create a channel where the patient is able to communicate back to you. Something like a headache, a day is enough for you to get feedback. I've worked in certain pharmacies where they are minded to take your number and give you a follow-up call to ensure that you are getting benefit.
Hold on that thought.
Yeah.
It's a pharmacy in Ghana, right?
In Ghana, yes.
They take your number.
Yes.
Well, Ken will speak for the masses whether it is the norm. That we'll go for a break. When we come, Ken, in your experience, when you go to buy a drug, do they take your number to want to check back on you whether you got or they take their money and go? That's the first one when we return from the break. And two, when we come back, as a layperson, what is your understanding if somebody says painkillers are for all forms of pain? When we come back, I'll take your thought on that. Viewers, we'll be right back.
Promo is here again. Buy a pack of Happy Delights and stand a chance of winning a brand new PlayStation 5. Here is how to win. Buy Happy Delights, follow our social media handles, follow the flow, take a picture of the top of your pack that shows the batch number, production date, production time, and keep it. Dial *899 *68 hash. Enter name, enter region and city, enter batch number, enter production date, and enter production time. Remember, the more Happy Delights you buy, the higher your chances of winning. This promo ends on 31st December. Share the happiness. Good life with healthy life.
Before we went on break, we were at the cusp of very interesting conversations. I will not even waste time, we'll go straight to it. Yeah. Ken, Farm said that he has worked in some pharmacies where when you go, they take your number and call to say what, follow up to see whether they.
I remember the question.
I shouldn't even repeat it.
Because it's not the norm.
Is that a norm?
You walk into a pharmacy and maybe because of where you live, and challenges and all that, you try to take a number, even of the pharmacist. Sometimes it's a problem.
Yeah, exactly.
Especially if it is the opposite sex. So even with the flip situation where you are going to call to find out, oh, this is what is happening, this is another effect I'm having, so that you don't necessarily have to drive over. That one is even a problem.
They don't want to give you the number.
Because for most people, it is about the money. It's not about the service. So if you stay home and you call me and I advise you, you might go to another pharmacy and the money doesn't come to me. So it's not the norm at all. It's not the norm. It's quite strange. Why it should be so.
But sorry, Ken said something that, so it's the sense he gets. And I shudder to think that there's a sense that a majority of Ghanaians, or let me not say majority since I don't have statistics to back, but a lot of people might have the same sense that in the pharmacy, the concern is about the money that they are taking, but not the care.
Yeah. Why
do you think this might be?
No, I mean, I think we have to be honest. The pharmacy, as it stands, has overheads. It has to survive. It's a business on the one part, but it's in the business of giving quality health care. There's no excuse that a pharmacy shouldn't do what it's supposed to do, and it's basic. I would estimate that they may not be able to get the contact of every single patient who walks in, but at least there are certain cases that, for the nature in which they are, you should be invested in getting to know, because the long-term gains are better. Once I build that relationship, you mentioned a point about calling you and the person going somewhere else, but it is also the case that once I build that rapport with the patient, the next time he will be minded to call me. And I have had patients calling me even at very odd hours because I have extended a certain level of care. And that sometimes brings satisfaction of care. But the point is, and there are a lot of things happening. Not all pharmacies are there yet. And I know that things are being done, even in terms of the professional development and trainings that go on year in, year out. Pharmacists are expected to take part in. Some of these things are done heavily. But I expect that things should change in the near future. We should have a bit more personalized care. there are concepts that talk about individualized patient care. That where when we get to the situation where there are enough pharmacists to patients within the community, I should build a relationship with certain community members that I'll be the first point that they'll come to when they need education on drugs or when there's a problem.
I agree with what you're saying. Yeah. You remember last week I was talking about the fact that I have a personal pharmacist. Yeah. He does that. And he builds that relationship with time. Yeah. And so I don't struggle. He can call on me just out of the blues. Yeah. Just to check how you're doing, whether everything is fine with you. Sometimes you just ask you, have you dewormed? Because, but unfortunately, it's not like that in the majority.
And I think the point here is that this is something that is desirable, that in the pharmacies it will be desirable. And now there are softwares. You just enter the person's number, and when they come in, the next time they are in, you just type either the name or it's easy to track your patient, get
in most of the softwares now, a patient comes in, especially if it's on a chronic medication, hypertensive, you log in the patient, and you log in the date they took the drug. So once it's getting close, a few days to the system will prompt you that this patient was here. Then I can call the patient before I runs out, oh, your drug is getting close to refill. Should I deliver to you? Because right now, the world is moving away from brick and mortar. So if I can get to you and I tend to your needs, why would I sit in a shop, pay rent so much, and expect someone to walk in? You simply lose money. Okay. But I think we'll get there.
Ken?
And then the second question.
Yes.
I think in the majority, all painkillers can cure all manner of pain. Especially when it comes from, you have a name you call it, when it's recommended by a peer. Yeah. That, oh, I had this pain and I took this painkiller and I was fine. Yeah. And so you can also try it. Whether it is headache or ankle ache or whatever ache, once there's a painkiller to go into the system to take care, to deaden it, it is fine. Without looking exactly at what the roots cause may be. Yeah. So that's what I know pertains. Until recently, I didn't even know that if you are ulcer, there are certain painkillers you don't take. And so that's what we do.
And you're absolutely right. And that is where the pharmacies and the pharmacists are supposed to play a very critical role. Because it's so important, it is so basic to do that when you don't do it, it just causes problems. Because in your case, not every pain, it's a painkiller, an analgesic. It doesn't mean that it can cure every kind of pain. And you need to let patients know. One of the cancers we've been dealing with at the community level is a concept they call people being on cocktail of pain meds. They just buy a bunch of pain meds. And there are these brands all over the place that do a mixture of different analgesics together. And people are on it. And you mentioned also some of these products are actually on long-term use can predispose you to getting an ulcer.
So some of the painkillers can cause you to have ulcer if you abuse them.
Yes.
Okay. So it's not just that when you have ulcer, you don't take certain painkillers.
Not at all.
Certain painkillers can actually
cause because people get dependent on these things and they continue to buy it. And you see, pain also has, it can be anecdotal, but it also has a thing of the mind. So when you mentioned the Gary thing, in drug we have the active and what we call excipient, something to hold the drug together. So paracetamol has an active component, but because it has to be something you can swallow, they add starch and other things to hold it together. And those things do not work to give you to relieve you of pain, but they're an active ingredient that it holds. And so someone may take something else that contains an excipient and assume that it would cure the pain. There's also the traditional beliefs. Growing up as a kid, I remember I used to have constant headaches. And one of my aunties went to the village and said they do this thing where they tie something in some leather thing and then you put in your head. Subconsciously, cures pain, you put it in your head, hang it around and sleep overnight, and the pain is supposed to go. And you wake up, oh, it's gone. I mean, scientifically, how do you justify what is inside it? It doesn't go into what is inside. It can only be spiritual at best. But all those things also play a key part. So someone taking a drug, you get dependent on it. So when you don't even have a pain, there's a sensation that I have pain. I must take it. And so you go in and take it. So there are studies that have shown that for some people who are on chronic pain, they give you placebos. So you can give you a tablet that looks like what you have been taking. In actual sense, it contains nothing. It just contains no drug. But it looks like it. The person takes it. Oh, I feel fine. It worked. It worked for me. No, it's for research purposes. Like, so you don't know, you've seen it as your drug, but you don't know whether it's a placebo or it's not. So the placebo is just an empty drug. It looks like your drug, but it contains no drug. But you take it and then your mind triggers. It's working and you feel okay. So the pain is such a crucial thing that I think at that level, even for the lay people, you should understand whether your pain happens one-off, that you can pinpoint the source to, or it is chronic. You are in severe pain, the drugs you're taking are not working, and for that reason you need to see somebody who can then advise or step up on if you need to add more medications or move to a stronger medication. I think that is very key for people to identify.
Okay.
This is for the masses because I stand for them. There hardly is any home in this side of the world without a painkiller in reserve. What I want to know is that, do you keep such painkillers, take it, and go and seek further attention, or you take the painkiller and see if you'll be fine and forget about what happens next?
So, at home, first aid kit, we advise to have very basic, like Panadol, which is paracetamol, just something very basic. I have a headache here, there, somebody has, you take it and it resolves the pain and you are fine. But if the frequency is becoming too much, you are realizing that you are taking it almost every day. You cannot be having headache every day or every other day. So if it's becoming frequent, you may take it at an instant to relieve you of the pain. But then at that point, you then have to consider seeing your pharmacist, if it's a pharmacy, or if you have to go to see your general practitioner to give him a picture of what you've been going through so that a proper assessment can be done. But if it's a one-off thing and I take it and it's fine, it's something to have. In the middle of the night, you wake up with a headache and you just take it and it relieves you, and it's not something you are dependent on, that is fine. But if it becomes something that you consistently notice you have to take every now and then there's cause for concern, and I think at that point you need to engage somebody.
Are painkillers addictive?
Some painkillers are addictive, very addictive. Some are. The opioids are very addictive.
I'm asking because I have a friend who now loves a particular one, which we all know, because it was used to help him in numbing a particular pain. And because he got to know from the practitioner that this is what I gave you, he manages to get it. And now he's become very dependent on that.
That's a problem, and if it persists, he becomes dependent on it. So it's not even a pain anymore. He just has to take it to feel a certain way, and that is the situation with the opioids. If it's the normal ones, paracetamol, those are fine. It don't have those tendencies. But for the opioids, they are very addictive.
Look, time is up. I mean, we didn't expect to exhaust this topic in just one sitting in a 30-minute, 25-minute episode. But I think you've made the clearest of points. So we'll end here. I'm sure we'll find another time to exhaust it properly and probably go into painkillers, and as Ken was asking about, are they addictive? You've mentioned some of them can cause stomach ulcer, and all that maybe in another episode we can elaborate on those things for our viewers to know. But at least for now, today, we've established that painkillers are not for all forms of pain. That's one. Two, don't just take painkillers for the sake of taking it, because it can have certain adverse effects on you. Three, speak to your pharmacist. Speak to your pharmacist. Speak to your pharmacist before you take any painkiller. Don't even think it's a common painkiller. So these are things we've established today. And viewers, I hope that we've learned. All too soon, we have come to the end of today's episode on pain and pain management. God willing, on another episode, we will exhaust the topic and explain further some of the things that we were not able to cover in today's episode. Thank you for keeping faith with us. Thank you to the crew. Thank you to all the team who work on the production. Until next week, see you again.